And I also know that that day was fueled by an awful lot of misinformation that also fuels people with misconceptions and so forth about the pandemic. And I remember on January the 6th last year, I watched what was happening and it came in to do a press conference to give a COVID update, and certainly that's what we're going to do today. I'm just going to encourage people to get their information from good, reliable sources, and to make sure that we base our decisions on science. I do hope everyone had a wonderful Christmas and New Year's. I can tell you we start 2022 in a very challenging place with respect to COVID. I suspect just about everybody in the state now either has just had COVID, has it today, or knows somebody who does. There has never been more of the disease in our state. Transmission has never been higher. The percent positivity never higher than it is right now. And that's because of the Omicron variant, and this surge is a direct impact on the state from the Omicron variant. I'm joined by Dr. Joe Cantor, as you see, and he will brief you in just a little bit over the latest guidance from the CDC, and we'll answer any questions. At a high level, I think the takeaway is that Omicron has rapidly taken over as the dominant variant here and elsewhere around the country and really around the world, and it's presently surging at an unprecedented clip. Today, we reported 14,077 cases of COVID-19. That is an all-time record for a 24-hour report. There were 1,412 people hospitalized across the state of Louisiana with COVID-19. This is a net increase of 125 since yesterday. And very sadly, we're reporting an additional 12 deaths today, which brings us to 15,038 since the beginning of the pandemic. The percentage of emergency department visits related to COVID-like illness remains at an all-time high. The average daily incidence of COVID has exceeded its Delta surge peak across the state of Louisiana. What is not captured on our COVID dashboard currently are reinfections, which we are seeing more of because of the Omicron variant than we saw before. To illustrate this, in November, we recorded 563 reinfections, and in December, as the Omicron rapidly surged and became the dominant variant of COVID-19, the number was 11,278. So 563 in November, 11,278 in December. These sharp increases are due to the continued rapid spread of the Omicron variant, which I just mentioned, and it spreads faster than the other variants, and also, obviously, natural immunity conferred on individuals because of COVID-19 that was caused by previous strains doesn't seem to hold up very well at all against Omicron. The Department of Health estimates that the proportion of Omicron cases in our cases today, as of January the 1st, was 90.2%. And that was up from previous reports. And certainly today, it is higher than that. And in fact, the CDC estimates the proportion of Omicron in the region, and the region includes Arkansas, Louisiana, New Mexico, Oklahoma, and Texas, is 98.2%. So for all practical purposes, virtually 100% of the COVID in Louisiana today is due to the Omicron variant. And with its increased transmissibility, we know that we were expecting to see a higher percent positivity. We are seeing that. As of December the 29th, the 7-day cumulative statewide percent positivity was 27.1%. The previous 7-day period had our percent positivity at 10.7%. almost tripled in 1 week. So it is more transmissible than anything we've seen before. And I know that there are estimates out there, but it seems like most of them say it's about 3 times more transmissible than Delta was. And that certainly is borne out in these numbers. Omicron is surging across the country. On Monday, the United States reported a single-day number of daily COVID cases with more than 1 million new infections. And when you look at 14,000 today in Louisiana, on Monday it was more than 1 million for the country, and you understand that the best estimates are that for every reported case, there are 2 to 3 cases that are unreported because people are testing positive at home, and that testing information is not being reflected in any of the numbers that are being captured out there, or people are so mildly infected or maybe asymptomatic that they're just not testing at all, which is why I started off the press conference saying that there's a very good chance that just about everybody that I'm speaking to today has COVID, just got over it, or knows somebody with COVID today. In response to this Omicron surge and after reviewing the latest data on COVID and the vaccines, the CDC has updated some of their guidance in the last couple of weeks. Dr. Cantor's going to go through some of that with us. And you're going to hear from Dr. Cantor that certainly we need to all be paying attention. Again, not panicked, but showing due concern and prudence as it relates to this disease. And the high level of transmission that's taking place right now, and that gatherings with people outside of your household, indoors, unmasked, especially if you are not vaccinated or if you're not boosted and so forth, really is not something you should be entertaining, especially if you're one of the individuals out there who are more vulnerable to the disease by virtue of your age or an underlying comorbid health condition. There is some good news, and it's always relative, right? But the truth is, Omicron is less virulent than previous forms of COVID-19, and that's helpful because while the transmission is an all-time high, fewer people who are getting it are going to have a serious illness from it. Fewer people are going to need medical attention and be admitted into the hospital, need oxygen therapy, for example, or their stay in the hospital will be shorter and all those sorts of things. The challenge with, and that is good news, because if that were not the case and we had a variant of the virus that was spreading like this one, we would be in much, much worse shape here and around the country and around the world. But it is simple math. Even if it is less virulent, and it is, if many more people on an order of magnitude like we're seeing are actually being infected, then you're still putting tremendous demands on your healthcare delivery system. I just told you more than 1,400 individuals are hospitalized across our state today. That is a little less than half of the peak with respect to Delta, where we got to 3,022. But we have an awful lot of nurses, doctors, respiratory therapists, EMTs, paramedics, you name it, who are not at work today because they too have COVID because of Omicron. And so it's a function of both the census and the staffing that really create the challenges. And the challenges don't just impact patients who show up at the hospital because of COVID. We're still going to have strokes and heart attacks and motor vehicle accidents and those sorts of things. But Omicron is less virulent, and we can be thankful for that. But we cannot count on that to answer all of the challenges that we're having today. Other good news, in December in Louisiana, almost 80,000 individuals received their first shot, and more than 277,000 individuals got their booster shot. We know that that's important. That remains the most important thing for people out there to do to protect themselves and, quite frankly, their families and their communities from COVID, and that is to get vaccinated and get boosted. Thirdly, current vaccines do protect against severe illness. hospitalizations, and deaths due to infection with the Omicron variant. And that is why so many people have chosen lately to get vaccinated, and why those people who have not yet made that decision really ought to be vaccinated. I would ask them to contact their healthcare provider to ask any questions that they may have. And those who are eligible for a booster, get boosted. And Pfizer boosters are now available and recommended for young people from age 12 to 17. Dr. Cantor is going to come up now and go through that and a few other bits of information. As we typically do, I'd ask you, if you know you've got a question for Dr. Cantor, let's go ahead and ask it while he's up here. And then once he's complete, I'll come back up and then we'll go right into your questions. Thank you.
Thank you, Governor. Good afternoon. Not the way I would have wanted to start 2022, but we've been here 4 times before in the middle of a surge, and just like those 4 times, we will get through this. I genuinely believe that. I'm going to walk through some of the latest data, talk a little bit about what the CDC announced in terms of guidance or recommendations, and then talk a little bit about the path forward here. So if you could back up one slide, if you don't mind, Jolie. The day-on-day case counts are really staggering right now. And as the governor mentioned, we just have not ever had as much COVID circulating in the state as there is right now. And I say that in full recognition that we have said that before as well. But the daily case counts that we're seeing now just completely dwarf the case counts that we've seen prior. Today, we announced over 14,000 new cases of COVID, new people who were identified as COVID positive. That's the largest single-day case count that we have ever reported, and we've not yet seen any sign at all that it's slowing. If you look at this graph, this is new cases identified each day, smoothed out over a 7-day average. You can see that we're ahead of any point in the past, even the Delta surge a few months back, which was the largest one that we had to date. It fits with what is being seen nationally. This Omicron variant has just taken the country by storm very, very quickly. And again, we've not yet seen any sign that it's slowing. It continues to go up at a very, very sharp pace. We, this week, are at a rate of over 1,000 cases of COVID per 100,000 residents per week in Louisiana. To put that 1,000 number, it's actually 1,030. To put that in context, when the CDC categorizes community transmission risk, they use a 4-point scale, 1 to 4s, and 4s being the highest risk. If an area, a state, or a parish has over 100 cases of COVID per 100,000 residents per week, that's enough to put them in the highest risk category. We have 10 times that right now. A lot of other states do. Just making the point, I've never had this much COVID being diagnosed and spread on any given day in Louisiana. Go to the next slide, please. Go through, this is a slide that we look at quite frequently, and I want to look through the various data points here. On the top left, you'll see a graph on COVID-like illness. This is a graph of how many people are going into emergency departments throughout the state with symptoms that could be COVID, fever, cough, those sorts of symptoms. We're at about 16.7%. That means 16 or 17% of everyone in an ER or a waiting room right now are there because of symptoms suggestive of COVID. It's about where we were at the peak of the Delta surge. It's a very, very high number. The top right, you'll see that same incidence graph I just showed you a second ago, highest that it's ever been, and really no sign that it's rounding a corner or slowing at all yet. On the bottom left, you'll see a combined graph where the orange line is testing volume. How many tests are we doing across the state? and then the bars below that are percent positivity. Right now, we're testing about 358 tests per 10,000 residents per week. That's a high number, but if you look at that graph, we've been higher in the past. So I think there's a lot of testing happening. I think there'll be more testing as it continues to spread, but we actually have done more tests than the past. So I don't want anyone to think that we're just seeing this many new cases because there's a lot of tests. There are a lot of tests being done, but we've actually had a higher testing volume at a couple points in the past. The percent positivity, those bars on the bottom, is really troubling. We more than doubled this past week from 10.7% of all tests being conducted coming back positive to 27.1%. That's the highest number that we had ever since the first surge back in March of 2020. And the difference is back then we had no tests. So it artificially inflated the percent positivity. What the governor said, it rings very true. I mean, everyone knows someone who's positive or is getting over an infection themselves. It's really, really prevalent right now. The bottom right is the graph that we really pay the closest attention to, and this is what's going on in our hospitals. So today, 1,412 COVID positive patients are in our hospitals. 76% of them are not vaccinated. That number is relatively consistent with what we've seen in the past. And 60 of them are on mechanical ventilators. This speaks to the small silver lining that the governor mentioned. That's a lower percentage than we have seen in previous surges. In prior surges and in the past Delta surge, on any given day, somewhere between 15 and 20% of the COVID positive inpatients in hospitals were sick enough to be on ventilators. That number is lower now. Now it's been between 4 and 5%. And it speaks to exactly what the governor mentioned. All data points so far indicate that, thankfully, Omicron is less virulent, meaning on average, it makes people less sick. If you get it, on average, you're going to be less sick than if you got Delta or one of the prior variants. There's a couple of big caveats to that. Number one, these are averages. So it's still possible to get very sick with Omicron, and we see it a lot. So it doesn't mean that you're guaranteed to have mild as opposed to severe illness. And the other big caveat, as the governor mentioned, is when you factor this in the context of many more people getting infected in the first place, those numbers add up quickly. So we have a variant that's marginally less virulent, meaning on average, it's making people a little bit less sicker. On the other hand, you have many more people getting it. So that's why the hospitals are still very busy, because you add those numbers up, they still end up being very large numbers. Those 16 or 17% of ER patients that are there seeking care or testing because of symptoms suggestive of COVID, that's in addition to all the other patients that are going into the ER for all the other things that we go into the ER normally. It's added volume to an emergency department. It's one of the reasons why hospitals are really trying to keep up with the volume while they're so busy now. All of that is added volume on top of what a hospital normally sees. That brings me to a couple requests I'd like to make of folks. We have to be cognizant right now for the next few weeks to not do anything that overburdens a hospital or an emergency department. So if all you need is a test, if you're not that sick, if all you need is a test, I'm going to ask you, please don't go to an ER. Please find another place to get tested. It's not worth becoming another person in the waiting room, creating a burden on that ER. Try and avoid the ER if you can at all possible. There's no question that it's become harder the past couple weeks to find rapid take-home tests. We're talking about point of care or take-home antigen tests. There's a national shortage of antigen tests. And when I say shortage, I just mean that the supply doesn't meet the demand right now because the demand is much, much higher than it was a month ago. There's actually more tests out there than there were a month ago. There's just markedly increased demand right now. We feel that in Louisiana, it's everywhere across the country right now. We're working as hard as we can to get more rapid antigen tests, both from the federal government and also on the private market. A couple points to this. There is not a shortage right now of PCR tests. So people seeking the more formal, the more sensitive PCR tests, these are the ones that are more accurate, but do typically have a 1 to 3 day turnaround time. There's ample availability of those. If anyone needs help finding a place to get tested, I'll give you 2 resources right now. The first is 211. It's easy. They have the master list. And the other is, the list also lives on our website, which is ldh.la.gov/COVID test. There's about 400 sites across the state right now that people can get tested right now today, primarily with the PCR tests. If someone is looking for an antigen test, a take-home test, and they can't find it, but they have symptoms, in the context of the surge we're in right now, they should just assume that they have COVID and isolate accordingly. When you're in a surge like we are right now, when COVID is everywhere, and it is everywhere right now, if you have trouble getting a test, a take-home test particularly, and you do have symptoms, the prudent thing to do is just assume you have COVID, isolate away from other people. That's the safest thing to do right now. Go to the next slide, please. There, in prior surges, there was some regionality to our surges. Certain parts of the state were ahead or behind other parts. As we saw with Delta and now with Omicron, it's been a pretty consistent wave across the state. So 63 of our 64 parishes are in the highest of those 4 risk categories. And the 64th would be there just wasn't enough testing volume to meet the bar of what we need to count it. So there's a consistent risk of COVID across the state. There's no one part of the state that is that much different from some other part. Anywhere in Louisiana right now, really the region and most of the country, the risk of contracting COVID, particularly the Omicron variant, is as high as it ever has been before. Next slide right now. We're paying close attention to how that risk relates to various age groups, and we see a trend now that we've seen a few times. And I'll point out on this graph here, and you're looking all the way on the right, which is the current point in time, the leading age group right now in terms of new cases day on day is 18 through 29-year-olds. As we've seen in prior surges, we typically see an increase, a leading increase in 18 through 29-year-olds, and then that spreads to other age groups, particularly older people and younger people. So what happened in prior surges in Delta is 18 through 29-year-olds started off being the leading group, and then somewhere in the middle of that surge, younger people, those below 18, overtook them as being the dominant age group. I would expect that's what we see here. 18 through 29-year-old is leading right now. Schools, K through 12, are coming back into session now. I think we should expect to see that shift again in the coming weeks as lower than 18-year-olds overtake that. Some of the myths that have been talked about priorly in COVID that we know now not to be true are that younger individuals very much get COVID. They can get sick. On average, they don't get as sick as older people, but they certainly can, and they certainly can spread it to other people, namely their parents and grandparents. So we do need to be careful about this as we go forward over the next couple weeks. Next slide, please. I want to quickly note how impressive this increase in hospitalizations has been. 3 weeks ago, we had about 200 patients with COVID in the hospital, and today we have over 1,400. So it's increased by almost a factor of 7 in just 3 weeks. That really is a remarkable spread. And please be understanding, if you do need to go to a hospital, avoid hospital care if you don't need it. Avoid the ER if you can get your service some other place. The hospitals are very busy for that reason right now. In the few weeks experience with Omicron, we've learned a lot about it. And I'll review now the main points that we know about Omicron. There's no question that it's more transmissible, probably 2, 3, or 4 times more transmissible than the prior strands of COVID. And you see that in these very high case counts. Very easy to contract Omicron from someone else. It's by far the dominant strand, both in Louisiana, where it's at least 90%, if not more, of our new cases. Our region, as the governor mentioned, where it's about 98% of new cases, and nationwide, where it's about 95% of new cases. So for someone who were to get COVID tomorrow, odds are extremely likely that is going to be Omicron. It is across all 50 states in the country. It's completely widespread. It does appear to be less virulent. Again, that's an average. It's not a guarantee. You're not guaranteed to have only mild illness if you get Omicron, but on average, thankfully, the patients we're seeing are less sick on average than those with Delta, and that's welcome news. Quite frankly, if Omicron was as virulent as Delta was, we would be in a much more dire situation than we are right now. It remains true that people who are unvaccinated are at the greatest risk, both for contracting the virus and for suffering severe outcomes, for getting very sick, for needing mechanical ventilation, and for dying from the virus. It also remains true that the best available protection right now is to get boosted, to get vaccinated, and if you are eligible, to get boosted. 21, 22 months into this pandemic, we have more tools at our disposal and more knowledge about how this virus spreads. It clearly is airborne. And if you remember, in the first month or two of the pandemic, there was an active debate about whether it was airborne or not. Hearing that, I do want to spend a second to talk about masks, because we haven't talked about masks in a little bit. And with Omicron, with how transmissible it is, I think it's a little bit more important to talk about these issues. If you're going to be around other people that are not in your household unit right now, you are much more protected, and they're much more protected if people are masked. The more layers of fabric a mask has, the better protection it generally confers. In a broad sense, there's really two reasons why we wear masks with COVID, why it's important. One is to protect those around you from your own respiratory spread. And the other is to protect you, the wearer. To talk about that first part, when we talk about a respiratory plume, this is, when I'm talking right now, there's a respiratory plume going out. That's normal. When I wear a mask, any type of mask, cloth mask, any type of mask, that greatly limits my respiratory plume, makes it safer for everyone else around. Cloth masks still perform well in protecting everyone else around you. What cloth masks don't do as well as other masks is provide strong protection for the person who's wearing them. And to provide strong protection for the person who's wearing them, you really get much more benefit from an N95 or a KN95. I'll tell you personally, I thankfully have not gotten COVID during this surge. If I have any choice in the matter, I would like not to. And so I've changed the mask that I wear in public, and I wear a KN95 right now, particularly because I want the added protection for myself. And what has changed between now and the first month or two of the pandemic is it's much easier to get these. Very easy to get them online. That's where I got mine. And the KN95s are pretty easy to wear. They're generally more comfortable than a regular N95 is, and they give a lot of protection to those who are wearing them. So for people that want the most protection for them, at this point I would recommend getting a KN95 or an N95. And again, they're pretty easy to get online right now. The supply is very good of them. Lastly, I want to cover some new CDC guidance and recommendations that came down the past week. First, for those individuals who received the Pfizer vaccine, the recommended interval between the initial first 2 doses and getting a booster dose was shortened from 6 months to 5 months. So if you've had Pfizer, if you're 5 months out from finishing that primary 2-dose series, you're now recommended to get a booster dose. And the booster dose is so very important with Omicron. Also, as of this morning, everyone aged 12 years and up is now recommended by the CDC to get boosted if eligible. There are 2 reasons for this. Number 1, booster doses have shown to be safe. And number 2, booster doses greatly increase your protection with the Omicron variant. Anyone 12 and up now is recommended, but which is a strong term that the CDC uses, recommended to get boosted if eligible. And then the third piece of recommendations are for people 5 to 11 years of age, if they are moderately or severely immunosuppressed. These are kids who unfortunately have cancer or chemotherapy or have other relatively rare conditions. they are now recommended to get what we call an additional dose or a third dose of vaccine. And that's something that those children and families should talk about with their doctors. Taking a step back, and this is our fifth surge. And though it may seem that almost everyone is getting it, you still don't want to get it if you have any choice in the matter. You do not want to get COVID if you have any choice in the matter. And the prudent thing to do now that we are in a surge is to take added precautions. It's as simple as that. We unfortunately surpassed 15,000 COVID-19 deaths in Louisiana this week. That toll continues to go up, and as the governor said, we added 12 additional deaths today. You do not want COVID if you can avoid it. When we surge, we have to take added precautions at the personal level. Now is not the best time to be gathering if it's reasonable to avoid it. If you do gather, it's more important than ever to take precautions like masking and distancing. This is not forever. We're just talking about a few weeks. This surge came on very quickly. The hope and expectation is that it will subside very quickly. We haven't hit that peak yet, but we're hoping it comes soon. So we're not talking about delaying things forever, but right now, while we're in a surge of this magnitude, please take added precautions to protect yourself and to protect your families. I'll tell you, I had the opportunity over the holidays to reflect on things that I am thankful for and grateful, and also what I anticipate will be challenges in the coming year. I'll tell you, I am grateful as it relates to COVID that we have more tools, many more tools at our disposal than we did this time last year. We have more therapeutics, even though 2 of our monoclonal antibodies don't work that well against Omicron. We have one that does. We have new oral medicines becoming available that are effective. We have a new indication for the medicine remdesivir. We have plenty of vaccines that still remain efficacious against Omicron. I'm thankful for all of those. I'm thankful for the better understanding of the virus that we have, and I'm certainly thankful for Governor Edwards' strong and sensible leadership throughout this. There's no question that the next couple of weeks are going to be challenging for us. We've been here 4 times before. We got through it then, and we'll get through it this time as well. I'm happy to answer any questions if there are any. Blake?
If the Department of Health has any modeling to show when you think the peak might occur, or if you're hearing from hospitals about when they think the peak might occur?
Nothing that I would put much stock in, to be honest with you. And we saw the same thing with Delta. The models with Delta were just all over the place and really hard to interpret in any meaningful way. That's the same thing that we're seeing with Omicron. You know, what a lot of these models do is just take the slope of increase that you're on right now and march that out a few weeks, which is not terribly helpful because it doesn't really tell you exactly, you know, what we're interested in is how many more days of increase are we going to have before we peak? And that's the real X factor that's hard to pin down. So I've not yet seen a model, unfortunately, that I feel comfortable relying on. Yeah. Yes, ma'am.
Can you talk more about what's going on in the hospitals? I mean, are we running out of beds? Seeing transfers from elsewhere like we were before?
Yeah, and also, I mean, for anyone that wants more context, I would really encourage folks to reach out to hospitals too, because they can really kind of paint between the lines in this, but they're extremely busy. And when you have 1,400 COVID positive patients in there, it's an incredible tax on the system. And when you have an added 16 or 17% of your ER volume, additional to what you normally have coming in because they have, most of them, thankfully, mild symptoms, that's a tax on the system. And when a significant number of your workforce is contracting COVID and has to be at home for some period of time, that's an added burden too. And when you really have a harder time to get auxiliary staff because every other state is suffering the same thing, that's an added burden. So I think hospitals are coping very well. I've never been more proud of our hospitals than I have the past couple of years. They've really learned how to make the most of their limited resources and how to best serve their patients. They're doing that right now. Their staffs are working incredibly hard with minimal downtime to serve their patients, but they're stretched very, very thin. Not as bad, perhaps, as a couple prior points in this pandemic, but again, we haven't peaked yet, and that's the concern. Yes, sir.
There are some studies that suggest that nasal swab will not pick up the COVID,
Yeah.
And those are fully vaccinated, or some that are just first-time vaccination. What are your thoughts on the difference between the nasal and the throat swabs? Are there any difference? And also with the home test, are people doing home tests with the throat?
Yeah, it's a great point. To talk about the difference between swabbing your nose and swabbing your mouth, there's still emerging data on that, and it's not conclusive yet. So we might know more in a few weeks. We don't know enough yet to really say conclusively to compare those two. With the nose, I mean, one point to make, because there's so many home tests being done, the accuracy of your test is related to the quality of your swab. And it's not comfortable to get your nose swabbed, but if you just put it up there, a fraction of an inch, you're not going to get enough sample on there to get an accurate test. It is true that the nasal swabs that we do ourselves are not as accurate as what we call nasal pharyngeal swabs. And these are, people will remember earlier in the pandemic, and still if you go to many hospitals and they swab you, they'll do the very long swab that goes all the way back and is very uncomfortable. That's probably the most accurate, but you're just not going to do that to yourself. It's not practical. So when you take an at-home test, a self-test, you more or less accept that it's a little bit less accurate than a test that you're going to get at a hospital by a professional administered, but you do add a lot in convenience. It's a give and take on that. Great. Last question.
Do you know when we can see more supply for that at-home sales?
Yeah. We think within the next coming weeks. I think the challenge here is every other state is in the same boat. So, when we advocate to the federal government, we're advocating in competition with other states. When we go on the private market to try and procure, we're doing that in competition with every other state. So the assurance, both from the manufacturers and from the federal government, is that there's more supply coming. It really can't come fast enough. I will say for people that went to their drugstore and they were out of stock, their supply changes day by day. I'll tell you, my household, we went 2 days ago, they were out. We went yesterday and our local drugstore had it. So I would encourage people to keep going and checking in with their drugstore. And if they do have symptoms and they can't get a test right then and there, in the context of this surge, you really have to just, act like you're confirmed to be positive, because you probably are. Thank you.
Thank you, Dr. Kenner. And we're going to have a press conference we anticipate next week, probably a week from today. We'll let you know, because we're obviously in a surge and there's going to be something newsworthy next Thursday. I hope and pray we will come out here and say we've seen the first evidence that we've started to level off. We're not seeing that evidence today. And, it gets back to the question about the modeling. There really isn't good modeling out there right now that gives us any assurance that we're soon to approach the peak, although that is our hope. And there is some evidence from other countries that are weeks ahead of us as to how long the surge lasted in those countries that was caused by Omicron. But the demographics are never the same. The level, the age, the comorbid health conditions, the amount of COVID exposure in the population beforehand, and all of that sort of stuff. And with respect to testing, I would remind everybody that once someone is exposed to the virus that causes COVID-19, they don't develop the disease right away. There's a period of time. And you may test after exposure and you're on your way to disease, but you don't have a sufficient viral load at the moment you test. And it may tell you that you're negative, when in fact you are on your way to having COVID-19. That doesn't mean that the test didn't perform well. it meant that your viral load at the moment you tested wasn't sufficient to cause that test to produce a positive result. And so that's a long way of saying that if you know that you have been exposed, please be very careful and do the things that we're asking you to do. And if you develop symptoms that are consistent with COVID-19, given the level of transmission that is out there, the number of cases, the percent positivity, you should absolutely assume that you have COVID-19. Yes.
Today starts the Mardi Gras season. You got lots of early balls this season, crews that have not done their thing for a couple of years.
Yeah.
I'm going to ask you to look in your crystal ball for a second. And should these crews start contingency planning, as it were, for possible restrictions down the line? Is that something you see happen?
Well, I think everybody, regardless of what organization they lead and whether that organization is their household and their family, should be looking at the situation and trying to figure out what additional things might we need to be prepared to do. What should we start to do right now? And make decisions that are consistent with what Dr. Kenner just told you, based on recommendations coming from the CDC and the Office of Public Health relative to the disease burden, the level of transmission that we're having at any given time. I would tell you that while I am not intending, as I stand here today, to institute any mandates, people ought to be very careful about those indoor activities where people are not going to be masked and they're going to be assembled in large numbers and in close proximity to one another for extended periods of time. And does that apply to a Mardi Gras ball? I think it's pretty evident that it does, right? And so if this continues on the path that we're in right now, when those balls come up and other activities, because there are a lot of people who are going to be doing things over the coming weeks that are not related to Mardi Gras, everybody needs to be taking these things into consideration. Yes, sir. Well,
So near the end of Dr. Kenner's remarks, it sounded like he's asking for this some extended cooperation for a couple of weeks while this thing is peaking and until we get through the peak. It sounds an awful lot like 2 weeks to flatten the curve. Do you think the people in Louisiana are ready to do that, given that 2 weeks to flatten the curve turned into 2 years?
Yeah. Well, first of all, I don't want anyone focused too much on 2 weeks. I think we would all be lucky if in 2 weeks we've reached the peak and we've started to decline in cases and percent positivity and so forth. I think what Dr. Kenner was trying to do was to state just how serious this situation, the level of transmission that's out there, and what people should be doing for the foreseeable future so long as we are in this Omicron-fueled surge. But without focusing necessarily on the 2 weeks, although we do hope that the peak will come. There are only so many hosts out there that are susceptible to carrying this virus. We don't know how long it takes for this virus to play out in this current surge, and that's kind of what the modeling is supposed to predict. But quite frankly, the modeling is all over the place, and it's sometimes not very helpful because all it does is show you the current rate of increase, and it just has that increase continuing without end. Well, we know it's going to end at some point, and really knowing what that point is why you want to see the model in the first place. And so the most essential information that you're looking for is often not in the model that we're looking at. And you all will know that there are some folks out there who are predicting that within the next week, 2 weeks, we're going to reach that peak. I really hope that happens. But whether it happens in a week or 2 weeks, so long as we are seeing the level of transmission, the level of disease burden that we're talking about, it's in excess of 10 times what is required to have a high level of transmission as defined by the CDC right now, all over the state of Louisiana. I mean, that's where we're at. We need people to do what they can to protect themselves and protect their families so that if we can avoid it, we don't all have COVID at the same time, and you called it flattening the curve. That's exactly what flattening the curve is like, so that you extend out the timeline when people are going to contract the disease, so that they're not all presenting at the hospitals at the same time, because we know we can't cope with that, and that the outcomes are going to be much worse if everybody gets sick at once. So I don't want to focus on the 2 weeks. The guidance that Dr. Cantor provided, I think, is spot on, and the rationale that he gave for that guidance is spot on as well. It's just what we have to do right now. And I know that people 22 months into the pandemic are tired of it. That includes me. But we don't really get a vote in that. Just because we're tired of it, we don't get to say, okay, go home, Omicron, pandemic, you've got to end now. I wish it were that easy. And we just have to do what is required to protect one another and protect our healthcare delivery system, especially for those who are most vulnerable and could contract COVID through absolutely no fault of their own. Yes. Go ahead.
Governor, I'm not sure if you heard this week about a student that was suspended for not wearing
Yeah.
masks in the classroom, and though there is no mask mandate, statewide in effect, but it is in schools. I was just kind of wondering what your reasons were, your thoughts were on that situation.
Well, you're talking about the case here in Baton Rouge at the lab school, yeah. Yeah. Well, for the reasons that Dr. Cantor just stated about the effectiveness of masks in reducing transmission and protecting the wearers as well as those in close proximity to the wearers of masks, masking is important. Masking is important in schools, especially after holidays, but really anytime, because you have people coming from all over the community into close proximity to one another for several hours a day. We know that the vaccination rates within the schools are among the lowest in the state because of the age groups that we're talking about. And so for those reasons, masking is important in our schools, which is why the current recommendations from the Department of Health are that schools, for the remainder of this surge at least, have in place a mask mandate. So we support the mask mandate. In terms of what happened with a particular student, I'm not going to look into that. I don't know, but I would suspect that those questions ought to be addressed to the school or to the LSU system. I can only tell you the mask mandate makes sense, especially in that environment where you're going to have those young people who have the lowest vaccination rates in the state, who have to be in that class. And if we want to have in-person learning with the fewest disruptions, then we need to control transmission. Otherwise, you don't have teachers. Your students are going to be out, and you reach a certain tipping point where folks are not going to be able to go to class. And that's not theory. I mean, that's happened here in this state before. It's happening all over the country as we speak. And so trying to manage transmission is very, very important. And that's why they have the mask mandate in place. So what I can say is that because the mask mandate at that school is consistent with the recommendations coming from OPH, and for the reasons Dr. Cantor has stated today, I believe the mask mandate is more than appropriate.
Last one?
Yes, sir.
Of course, it's a recommendation to have masks in schools, but there are plenty of school districts that aren't requiring masks for their students. I guess what's holding you back from implementing a school K through 12 sort of mask mandate like we've seen in earlier parts of this pandemic?
Yeah, well, we're providing information to all of the public through things like what we're doing today, but also we have regional medical directors in the Office of Public Health that are advising school districts and superintendents and so forth, and making sure that they have the best information possible. And we're leaving it up to them as to whether they institute a mandate or they don't, but we're making sure that they have the requisite information. And whether or not a school has a mask mandate in place, parents certainly can have their children wear a mask so that there is the greatest protection available for their child and for those in close proximity to their children as well. And I think that this is appropriate right now because unlike earlier in the pandemic, when vaccine was absolutely unavailable, vaccine is currently available for anyone 5 years old and older. And so we're not in the same place that we were previously. And we have more tools at our disposal, including the vaccine that goes all the way down to these age groups. And so school leaders can determine for themselves, and they're in the best position to know the percentage of their students who are in fact vaccinated and so forth, and then make those decisions. We are giving them information and recommendations to help guide in those decisions. And quite frankly, I wish more school districts, I wish all of them would take the recommendations of the Office of Public Health around a mask mandate. But at this point in time, I'm not going to impose that mandate from my position as governor. And because we always seek to make sure that we don't exceed our capacity to deliver care in our hospitals, that is really the barometer that we're looking at most closely to guide our decisions as to whether we reinstate any mitigation measures that we don't currently have in place at state level. And that's something we look at every single day. We talk about it very frequently because that's the one place you just can't get to. Otherwise, people have worse health outcomes than is necessary, including death, that would have been unnecessary just because that necessary treatment isn't available to them. And we got a question a while ago about whether diversions are in place. Right now, they're not, but they could be, and so forth. So we're going to continue to look at that. So let's all work and hope and pray and do what we can to make sure that we're protecting ourselves and our families, our communities. Let's get vaccinated. Let's get boosted, and then hopefully very soon we're going to be able to say that it appears that we've peaked, and then we'll actually have a decline in the transmission of COVID going forward. Hopefully we get to that point much sooner than later, but it is not something that we get to absolutely control by telling the virus what to do. We do have some say in it, but it's by doing things such as what Dr. Canner has recommended. So I thank you all for continuing to cover this matter. It is a tough start to 2022. I remain very optimistic that over the course of the year, we're going to be in much better shape across the board, including the pandemic, as even more pharmaceutical interventions and other measures are developed as the vaccination rates continue to increase. And hopefully at some point, this is going to happen, it's a question of when, this moves from being a pandemic to an endemic situation that we just certainly have to figure out how to coexist with, much like the flu today. But we're not there. We've got some work to do in the meantime. But thank you all very much, and we will see you next week.
Did you know that the food